BM is 53-year-old male, native Hawaiian, present to clinic on November 8, 2011 at 11 a.m. For checkup for diabetes and cough. For history of present illness, he has hyperlipidemia, diabetes type 2 begun in 2009, worsened when skipping meal, trying not eat if not hungry, and he also working on weight reduction. Another condition is hypertension, vitamin D deficiency. For past medical history, he has bone, joint, muscle pain, polyneuropathy in diabetes, peripheral vascular disease. For family history, he doesn't have no family history of CAD, CVA, diabetes, but uncle has a cancer. For social history, he's married, living with wife and granddaughter, 17 years old. Smoked tobacco, we don't know how many ppd, but for 20 years. Drink alcohol once in a while. Caffeine 32 ounces per day. He does a little bit of walking, yard work, house repair. For immunization history, everything is up to date, but he doesn't take any flu vaccine. For review of system, he experienced fatigue, night sweats, polyuria, polydipsia, but no fever, no weakness, no dyspnea, no wheezing. For objective, vitals. Vitals and a physical exam was taken on September 19th, 2011. Height is 5'4", weight 94.3 kg, blood pressure 120/78, heart rate 80, respiratory rate 20, temperature 97.5 Fahrenheit, IBW 59.2 kg, BMI 35.6, which is classified as obese. BEE equal 1818 kilocalorie per day. He seems very alert and oriented, well nourished, no difficulty hearing, no blurred vision, no physical assessment needed. For physical exam results, everything looks normal besides glucose being high, 154, and triglyceride 211, so it's high. HDL is low, 31, A1C is high, 7. For his current medication, for hyperlipidemia, he's taking Lovaza 1 gram 2 capsule POBID, fish oil 500 mg 1 tab POBID. For diabetes, he takes metformin and Lantus, hypertension, losartan. For pain, Ultram and aspirin, baby aspirin. For vitamin D deficiency, vitamin D3, and triamcinolone for no indication. Etiology, for risk factor, according to ATP3 guidelines, listed as cigarette smoking, hypertension, low HDL, family history of premature CHD, age more than 45 years old for man. In this patient, we can find age, cigarette, hypertension, low HDL. Because of diabetes that patient has, Framingham 10 years CHD risk score set to more than 20%, vascular age more than 80 years old. For evaluation, patient does need a treatment for this hypercholesterolemia, because patient is still experiencing high TGA level, and he has overweight and does not exercise much, and less of the other possible risk factors. Evaluating the medication. For Lovaza, this drug is appropriate. LDL goal is met because of this medication. No HDL is also met the goal. 30 higher than LDL's goal, which is 130. LDL goal is 100. Supplementation of long chain and 3-polyunsaturated fatty acid present in fish oil at dose of 3 grams per day have been shown to reduce plasma triglyceride up to 30% according to ATP3. Dose is appropriate, 1 gram BID, 2 gram BID is appropriate according to Faxan comparison. However, the current dose may not be adequate for this patient because since the patient is still experiencing high TZ. PO is appropriate and frequency is appropriate, BID. and signs and symptoms from this medication potentially can be the contributing factor for the increasing glucose level. He also take the fish oil. Fish oil is same medication as Lovaza, which is the over-the-counter one. So all the evaluation will be the same, but this is just a duplication therapy. For alternative class, there's HMG-CoA reductase inhibitor, which is a statin. It's not appropriate because the patient is experiencing the muscle pain, and statin can induce the myopathy. And there's a niacin, nicotinic acid, when the LDL goal is met and TG is 200 to 499, which is the patient's case. Usually most effective for lowering TZ, reducing 30 to 50% without causing reciprocal increase in LDL. At the same time, increase HDL about 20 to 30% according to ATP3. There's fibric acid derivative, which is gemfibrozil, reduced by 40 to 60% triglyceride and increase HDL by 15 to 25%, but often raise LDL by 5 to 30%, usually combined with statin. It is usually combined with statin to attain non-HDL goal, according to ATP3. In current regimen, there's a triamcinolone that with no therapeutic indication, and also within the current regimen, there is no interaction found between the drugs. For the under recommendation, we are going to recommend to start the gemfibrozil 600 mg BID 30 minutes before meals. It can decrease triglyceride by 30 to 50% and increase HDL by 5 to 15%. Discontinue fish oil as he is already on the Lovaza, which is a duplication therapy, and also discontinue triamcinolone since there is no therapeutic indication. And for the drug that can cause worsen or has an interaction for hypercholesterolemia is thiazide diuretic, beta blocker, progestin, glucocorticoids, anabolic steroid, cyclosporine, isotretinoin, protease inhibitor. Recommended test would be use a home blood pressure monitor to check blood pressure daily, and do a lipid panel test to monitor triglyceride, total cholesterol, LDL, HDL every 6 months, and also CK level and LFT, liver function test. Goals of drug therapy is to prevent the development of further and long-term chronic cardiovascular complications, and to maintain LDL levels less than 100 and non-HDL less than 130, decrease TZ less than 150. Recheck blood pressure in clinic 1 month. Also at the same time, check the lipid panel in 1 month following the start of the regimen. For the drug, side effects that needs to be monitored is diarrhea, increased glucose level, and increased risk of bleeding. For Lovaza, for gemfibrozil, there's a gallstone, skeletal muscle effects, renal insufficiency, abnormal liver function, and anemia. For patient education, for Lovaza, take 1 gram 2 capsule by mouth twice a day. Please take with food. If skip dose accidentally, take 1 as soon as possible, but do not double dose. If it's almost time for the next dose, please skip the dose, but do not double by making up the dose. Store at 25 degrees Celsius, room temperature. Avoid heat, light, moisture. Do not open, crush, dissolve or chulobada capsule. Side effects include increased risk of bleeding, diarrhea, glucose level. So if you have a severe condition, please let us know. For Genfibragel, take 600 mg by mouth twice a day before meals. For same concept, if you skip the dose, take as soon as you remember. It's almost next time. Don't make it up by doubling the dose. Store at the room temperature. Do not crush, chew, dissolve. Side effects can include gallstones, skeletal muscle effects, renal insufficiency. So please report to us if you're experiencing any of those. Please come back to the clinic in 1 month to check the lipid panel and also the blood pressure. For the we are going to stress the importance of lifestyle change. So change to healthier diet and avoid eating too much fatty foods such as fast food, butter shrimp, fatty meals, whole milk. Eat a variety of foods such as vegetable foods, grains, and foods high in fiber. Increase your physical exercise for at least 30 minutes a day, starting at 3 to 4 days a week. Start off by walking around the neighborhood or doing yard work. Avoid drinking alcohol, for it may interact with certain medication and it is a high risk factor for this condition. If you must drink, reduce consumption to only 1 to 2 beer per day. And please reduce the amount of smoking as well. For the information resources, um, we are going to provide the small brief summary of the ATP3 guidelines. That's it. Thank you.